we started seeing a gap in how parents in the hospital and outside of the hospital figure out how to introduce solids to their babies. And there were a lot of parents who were really struggling with this transition and figuring out how to get from point A to point B and then eventually get baby into the family meal. So this became a really big area of interest of ours and became a passion project, which is how we ended up with Solid Starts. But I'll let Kary give a little spiel about herself too.
Yeah, I'm Kary Rappaport. I am also a pediatric occupational therapist and board certified lactation consultant. Like Kim, I've been doing this work for over 20 years for me now, specializing in infant and toddler feeding, eating, and swallowing issues. We joined Solid Starts about 5 years ago, and we're a company that provides online education and guidance for families on starting solids safely and using the family meal where possible, focusing on family foods and cultural foods. So we're really excited to be able to talk to you about this topic. We feel very passionately that infants and toddlers are extremely capable, and following their interests and following their lead is a great way to build their joy and to increase engagement at the table.
Yeah, so we'll go ahead and get started with our main focus today being on facilitating child-directed or child-led transition to solids and eventually the family meal.
So we like to start by just thinking about why we're starting solids, because a lot of times it sort of gets talked about as though it's a moment in time, like, oh, today we're starting solids or we're just about to start solids. But really, when we think about why we're doing this, it is not because one thing is happening today. It's about a skill set that is being built for the duration of this child's childhood and then life. And we're working towards things that are much bigger than just what we assume when we're starting solids. We're working towards being able to eat a wide variety of foods, but we're working really towards what we see in this video. So we're looking at bringing a child into the family meal. We're looking at bringing them into practices and cultural experiences that are unique to your family. And then and building really positive and joyful experiences at the table. There's a whole host of skills that we're learning that extend far beyond learning to chew and eat foods. We're learning how to be patient. We're learning how to problem solve. We're learning how to be socially engaged while also trying to figure out basic fine motor skills and oral motor skills. There's a lot that's happening when we're starting solids, and we like to remember that it's a very complex process that takes time for a baby to develop and hone the skills that they need in order to be a successful participant in the family meal.
And the majority of the people in this session would probably be on the side that children learn best when they are exploring things on their own and they are making mistakes and they're figuring things out based on the skill level that they have. And starting solids is a perfect opportunity for a baby to do just that. And you can see, we can watch this video again. Blythe here is about 5.5 months old, sister's here, and they're exploring this family experience together, but more importantly, the baby is getting an opportunity to figure out something that's complicated and complex, but using the skills she has to try, fail, and try again. So I feel like, or we feel like the Montessori approach that you guys are talking about this entire week is viewed right here in this one simple meal. In this case, the little baby is barely getting the food to her mouth, but she's figuring out that this food feels a little different in her hand than maybe a toy does. She's figuring out that it might not stay on the table very easily. Sister wants to help her, but this little girl is figuring out how so many things about food by just trying and experiencing. So we do want to talk about when to start solids, because this can be a hotly debated topic, depending on what your pediatrician says, what groups, what your parenting groups may say. And we have done a deep dive of the literature to find out when babies actually should be starting solids. Now, this is not to say that if your pediatrician has made a specific recommendation for you, that there's not a good reason behind that. But when we've actually started to deep dive into the developmental and the nutritional literature, there really is no reason to start solids before your baby is showing signs of developmental readiness. Now, again, from a Montessori perspective, the reason that we want them to show signs of developmental readiness is we want them to be able to engage and participate in this experience. Your baby has to have the cognitive or the thinking skills as well as the motor skills to be able to participate in mealtimes, not have mealtimes done to them. So what we're looking for is we want the baby to be able to sit with support. Now, by no means does this mean that the baby needs to be sitting absolutely perfectly. You can sit them on the floor, they can sit on the floor, and you can walk away and do the laundry and they never topple over. But we do want them to be able to keep their head and neck upright when positioned in something like a high chair or sitting on your lap. So we know that those muscles that they need for chewing and swallowing are strong and ready to do their job. You also want them to be able to use their arms flexibly when they're sitting. So if you have a 4-month-old at home, you may be able to put them in a high chair just like Blythe is here, but the second they try to use their arms to do something, they completely topple over. The therapy world would describe this as a base of support being nice and strong, but thinking about it from a parent perspective, you just want them to be able to use their hands without falling over. And then finally, you want them to be interested in food. So you can see this video right here of baby Riley. I don't know if you guys can see it, depending on where your video is. But you can see that baby Riley is like watching mom bring the food to her mouth. She's so curious about what's going on here. She's like, wait, mom, this looks really cool. Let me participate. So that cognitive interest in food and eating is also extremely important. Oops. It's always great for moms to give nice encouragement too. So something that we see a lot is that pediatricians start talking about starting solids around 4 months. And this is a really beautiful visual representation of the difference of what a baby can do at 4 months versus what a baby can do at 6 months. Now, at 4 months, many babies can use all of their muscles to kind of go really, really strong and just try to sit up. And you can see this little baby is trying really hard to hold herself upright, but the only way she can do it is with this pillow around her and by pulling her arms together to support her entire body. There's no way she can reach out and grab something. The idea of her actively being able to participate in a meal would be very, very limited with the amount of motor skill she has at this moment. Now, this same baby just 2 months later, is she sitting perfectly? No, but she has so much more flexibility in her movements. Whoops, and mom's there to help her and make sure that she doesn't completely fall over, but she's able to actually sit, use those muscles in her trunk and her head and neck, but then also be able to reach something and bring it to the mouth. This baby is going to be able to participate in a meal in a child-directed way.
And we know that it is not about a specific age. So it's not that you start solids at 4 months or 5 months or 6 months. It's really about looking for those developmental skills that Kim talked about. And the literature is clear that most babies show that constellation of skills around 6 months. Of course, some babies will show it earlier, even at 4 months or at 5 months, but some babies will show it a little bit later at 6.5 months or a little bit closer to 7 months. And we want to see those skills there because it shows that the baby is ready to participate safely in meal times. All right, so let's talk about a few different areas that go into starting solids. We're going to talk about creating a safe eating environment because it's really important that we support the baby through the environment rather than trying to control them or control their body. We're going to talk about different ways that we start solids, different methods of starting solids, and then we're going to talk a little bit about introducing common allergens. So when it comes to creating a safe eating environment, one of the most common ways is by picking and choosing a correct high chair or a high chair that puts a baby in a position that makes them supported so that they can participate in the meal. So we're not advocates of any one specific high chair, but we are looking for a high chair that can allow the baby to sit totally upright. So commonly parents would recline a baby, or you'll hear doctors sometimes recommending reclining the baby because it supports their body, but that puts gravity against them and pulls things towards the back of the mouth before they're actively ready. We actually want baby to be sitting upright because it shows they have good stability in their trunk to support the fine motor muscles in their neck and in their mouth, and it supports their respiratory system. We also want the chair to have a removable tray. This is important because we want to ultimately bring the baby to the family meal. We don't want them sitting somewhere separately, having their own meal in their high chair. We want them to be a participant at the table with the rest of the family, because we know that modeling our behavior for baby is extremely important for helping the baby to learn the skills that go along with what happens at a meal, which is communal, it's conversational, it's reciprocal. There is a lot of relationship happening at meals. So we want a baby to be part of that. So removing the tray and sliding that chair up to the table can be a great way to facilitate that. We also like to have chairs that have an adjustable footrest. The footrest is something that allows baby to have extra support through their body. While it is arguably non-essential, the research is pretty clear that it does help support the respiratory system and gives the baby and gives an adult as well more stability through their body while they are exploring foods. And that stability through their body helps, again, support those fine motor muscles and movements in their neck and their throat, which can make eating and exploring foods that much safer and more enjoyable for the baby.
So something we like to remind adults about is when you're at a bar and you're sitting on a bar stool and it doesn't have a footrest, you probably feel a little bit less stable. You might be a little less comfortable. There's something about having a place to place your feet and bear weight into that allows your entire body to feel more stable. So while not every baby needs a footrest to be successful, we have found that babies that are struggling a little bit, or ones that don't want to sit in the high chair, or ones that are having a little bit hard time participating in meal times, that footrest can be key to really getting them over the hump of being able to participate.
A supportive high chair goes such a long way to facilitating participation, and not just participation, but joyful participation, a sense of calm, active engagement. And you can see here in these two side-by-side pictures, we have the baby on one side who is reclined in their chair. They're leaning back. The angle of their hips makes it so that they're leaning away from the table. This is going to make it challenging for them to lift their arms. So if you're sitting down right now and you lean back, you'll see that it's actually hard to get your arms all the way up. If you're sitting nice and tall, your arms have more movement to them. You're more flexible. So we want baby to look more like the one that you see on the right, where baby is sitting with their hips and their knees and their ankles at that 90-degree angle, where they have really good movement through their trunk. They should be able to lean forward, lean back, twist, move their arms pretty flexibly. You can see more examples of this here. You see baby Mila at 6 months old is in a high chair that actually has a more reclined position to it. And while you may not realize it, but just by looking at this, if you contrast with the picture in the middle, you can see that the one in the middle with a little bit of support behind her, so a towel roll placed behind this backrest thing that sits her more forward, she looks so much more ready to participate. You also have lots of options for adjusting a high chair that isn't ideal. So this chair wouldn't be one that I'd say automatically places this baby in an ideal position, but towel rolls, pillows, you can put a pasta box under the feet, or a book that allows the feet to have some extra support, and potentially cushions underneath the bottom to sit baby up higher gives them so much more support to put them at an advantageous position so they can participate. And you can see baby Mila here when she is in that high chair without all those supports, without the better positioning. It's very hard for her to use her arms as flexibly and successfully as she needs to. So she grabs the food, she gets it to her mouth, but you can see her shoulders are hunched. She is holding the food. Her neck is extended. She is not in the most ideal position. She's going to fatigue quickly because this is a really new and challenging skill for her. If she was better positioned, like you see in the middle, it would be easier for her and more comfortable to engage for longer periods of time.
Now, you don't need a high chair to be successful with starting solids, and a lot of families choose to not buy a high chair, or there's just not space in their environment for one. So two recommendations that we have are just having babies sit on your lap or positioning them on the floor. So over here on the left, you can see Maya with her dad. One of the things we like to make sure that parents understand is that you do want the baby to be snuggled in nice and close against your body and facing the table. In an ideal world, their feet are positioned nice on the chair, but that doesn't always always work out, and that's okay. If the baby is a little bit too low at the table when sitting on your lap, try not to put a pillow underneath baby's booty, but have the parent sit on a pillow to boost both of them up. Baby sitting on the pillow makes them a little bit more wobbly. Parent has the control to deal with that wobbly situation. And then over here on the right, you can see Blythe again, sitting on the floor, enjoying her meal. And I think this one's a video too, or enjoying her snack here. And she's just sitting in a ring sit position or a tailor sit position. And I'm right behind her, supporting her body so she can use her arms flexibly and make sure she can get that food to her mouth. But a high chair is great, but if that's not an option, both of these situations can work really well.
We have a lot more information on positioning in a high chair and choosing a high chair on our website, should you or friends or other family members want to know more about how to safely do that. All right, so when it comes to what to serve baby and how to serve baby, there are a few different options. Historically, babies were fed with purees, assuming that was all they could eat texture-wise at first, and then eventually you'd move on to gradually thicker purees, and then eventually to small pieces of finger foods, and then eventually towards bigger pieces of foods. What we know is that if baby has all of those foundational readiness signs that Kim was discussing earlier, their ability to sit up, reach out and grab, bring food to their mouth, and they're interested, they have the foundational support through their body to safely explore not just purees, but also finger foods. We also know that they have the foundational ability to do it themselves. We do not need to spoon feed baby. And actually, we know from the literature on motor learning that baby learns better when they are doing it themselves than when we do it for baby. So when you're using purees, if you want to start solids with purees, we recommend that you focus on foods that naturally are pureed or that we tend to eat pureed as an adult. So things like yogurt and oatmeal and rice porridges and hummus are all things that the adult would also eat pureed. So you don't necessarily need to choose baby foods that are pureed just for baby.
And I think something that we forget about here, or that is maybe not as commonly understood, is that the beauty of serving things that you as an adult want to eat is that you will actually eat them with your baby and model eating behavior. So we find many times that when a baby is first trying to feed themselves, they don't really know what to do, because to them, this is just a new toy. They're really not so sure how to interact with it. How they figure out that this food needs to be picked up and brought to their mouth, and that it potentially tastes good, and that they can move it back to swallow, and that it can make them feel full, is that they're watching a trusted caregiver next to them, across from them, doing the same thing. So I don't know about you, but I have very little interest in eating a bowl of rice cereal or eating some, pureed carrots that came out of a can or out of a jar. If you are interested in that, great. And if you do want to go that route, that's fine. But we still encourage you to explore the same food so baby's mirror neurons can fire and see, ooh, the person that I love the most, that takes care of me and makes sure that I'm safe, is able to pick this up and bring it to their mouth. I know that I can do that too. So it's a big part of the learning process.
I also just like the fact that it gives your own hand something to do. So as a parent, it disincentivizes you, or sort of like slows you down from reaching in and doing it for baby, which gives baby the chance to explore on their own, which builds those problem-solving skills and helps them to learn. So you can see here that baby naturally reaches out, because 6-month-old babies, or around that time, naturally reach out and use their hands. So you want them to reach out for the spoon, and you want to give that over, or just remove the spoon entirely and let them explore the foods with their hands. If you think they need help, you can go ahead and load that spoon, but we recommend just doing that once and then setting it down and letting baby go from there. So you're not actively offering it to them, or you can hold it out in front of them and then let go. You want the baby to take the lead.
So in a similar way that we encourage the rest of motor development with a baby and a young child, we want them to make mistakes. We want them to drop the spoon. We want them to put the wrong end of the spoon in their mouth. We want them to end up putting their hands in there and then figuring out how to get their hands to their mouth. This is not about necessarily learning to eat. It's about learning to learn and deal with different situations that may be in front of them. So it's okay if they mess up. We want them to mess up. That's the beauty, in the learning is happening during the mess ups.
So another method of starting solids, like I was saying, was just skipping the purees and going right into finger foods, or doing a combination of both, but just knowing that you can start with those finger foods right off the bat. Your 6-month-old baby, when they show those readiness signs, or 5-month or 7-month-old baby, when they're showing those readiness signs, is ready for a wide variety of textures, not just purees. It's easier to see it, so let's go ahead and watch some videos. You can see 6-month-old Amelia here reaching out for a piece of brisket. She naturally brings it to her mouth because she is driven to do that, to explore things in her hands and in her mouth. And her natural reflexes start to kick in to actually begin that chewing process. So nobody has to tell her to do this. It's hardwired into her brain and body to begin exploring the food and chewing it. Also, watching you do those things helps her learn how to do that. You can see the same thing here in baby Kailani, 6 months old, exploring a piece of watermelon. This is a softer food, so we expect her to break off pieces pretty easily. She's already got a chunk there. There's a little piece there. She has, well, and we'll talk about this in a minute, protective reflexes that help her both explore these foods safely and then move them back out or spit them out of her mouth if she's not able to successfully chew them and break them down. So that is how this works. She's got protective reflexes and chewing reflexes that work together. The chewing reflexes naturally make her chew and learn how to eat those foods. The protective reflexes keep food away from her airway and help her to safely explore as she learns.
So something that you'll notice here with all of these different videos as we watch Cooper eat carrot is that all of these pieces of food are large. And for any of you that are new to seeing babies feed themselves finger foods, you might be like, oh my gosh, how is this safe? These pieces of food are huge. Aren't these choking hazards? Well, we're going to talk about choking in a moment. Something that I want you to notice here is that all of these babies are able to hold the food with their hand. For any of you that are familiar with the hand skill development in babyhood, we know that around 6 months, the only skill that a baby has is to grossly grasp an object. They don't have that little tiny pincer grasp to pick up small pieces of food. So in order for a baby to be able to feed themselves, we need the food to be big enough that their hand is able to locate it, close their fingers around it, and bring it to their mouth. Now, the other component here that I think is interesting for parents to know is that another reason that we love to go big is because it's simply easier for their brain and their mouth to do something with it. If you were learning to catch a ball, and I am not an athlete, so this is something that applies to me, if I were learning to catch, I would need to catch a beach ball, a basketball, something that's big, because something that's big gives my brain and my body lots of input from that object so I can see it, I can feel it, I can figure out how to catch it. Catching a baseball, catching a golf ball is much harder because our body gets less visual and touch sensation from that thing to know where it is and how it moves around. Same exact thing is going on with food. That big piece of food is telling the brain, this is how big I am, this is what I feel like, this is how I'm moving around, so the brain can tell the tongue what to do to chew or spit that food out. A small piece of food is much more likely to get missed by the brain. It just like we as adults, when we're chewing an omelet, might be able to find and locate a small piece of eggshell and spit it out. Your baby at this age doesn't have that level of sensory understanding or motor understanding yet. A really big piece of something crunchy, they probably would be able to identify, but that teeny one, it would get ignored and not seen by the brain.
We're going to talk a little bit about what characteristics we want to think about when it comes to serving pieces of food, because it seems like, well, does anything go? Just a big piece of food? There are certain characteristics that make food in large pieces more or less risky for a baby. So we'll talk about that in a minute, but just know that the bigger, the better for a baby to grab with their hand at first. So when it comes to starting solids, what we really want to focus on is self-feeding. So we're trying to facilitate that active engagement and giving baby the space to explore on their own and to follow their own natural curiosity that's baked in there. So if we're starting with purees and mashes and sauces, we want to load the spoon or put it in the bowl and put it in front of baby and let them go at it with their hands. If we're going with finger foods, we really encourage you to start with large pieces of soft finger foods that baby can easily grab with one hand and hold onto and bring to their mouth. If we are in that same vein, you can also offer what we call resistive food teethers or food teether type foods, which are large pieces of foods that are incredibly hard to break apart or to break pieces off of. So that's things like a big ear of corn on the cob. That's things like a spare rib bone. That's things like the pit of a mango that don't break when baby bites into it. Yes, they can bite off pieces of mango flesh. Yes, they can bite off pieces of meat. Yes, they can bite off pieces of corn. But as they do so, they're naturally compressing and starting to chew those pieces of foods they're breaking off. But the bone or the pit of the mango or the cob itself are not really breaking apart. They're just giving tons of input to baby's jaw, tongue, and palate to help their brain understand what's going on inside the mouth and build what we call a mental map of the mouth, which is what Kim was talking about, which is what we use to discern where food is and if it's safe to swallow.
So those foods are kind of like exercise foods. We're not expecting baby to get a lot of food in their belly from these foods, but what we are expecting is for them to learn how to move their tongue, learn how to move their jaw, practice these motions in a very low risk way while we as the adult in the room eats the same kind of food with baby. So this is a great comparison to, in a more video way, understand why we look at pieces or large pieces versus small bite-sized pieces of food. So we're going to talk in a minute about choking risk, but the most important thing that we want to identify here is what this baby can do with her fingers with a small piece versus a large piece. So let's just compare. Oops. Sorry. So these are just little soft pieces of pear.
And Maeve is 7 months old here. So we know that she should be using a gross grasp, her whole hand. Trying to pick things up with a more refined pincer grasp is hard. She actually almost succeeds, which speaks to the fact that she's got a mom who's really worked with her on her fine motor skills, but it's still quite hard for her and she doesn't really successfully pick up those pieces or bring them to her mouth, which means that she's going to lose interest pretty quickly and she's not actually going to be able to taste that food or get it into her mouth.
And something that we like to think about when we're looking at this too is this idea of what's the just right challenge for your baby to learn a new skill, but also want to continue trying. This is simply too hard. And the fact that she continues and is as persistent as she is kind of surprising for a 7-month-old. But most babies at this point would probably be over it and they would fuss, they would just not want to engage anymore. But on the flip side, and she's looking like, hey guys, I can't do anything, this makes no sense. But then if we take those pieces away and give her a palm size slice of a soft ripe pear, she's immediately able to pick it up and bring it to her mouth and explore it. The other thing that's beautiful about these big pieces too, and you saw her do this really nicely, is that not only did she reach for one hand, but she brought that other hand in to work together and brought it up to her mouth.
All right, so when it comes to large pieces of food or whole foods, finger foods for baby, there are some things we want to keep in mind to keep it as safe as possible. So there are foods that you want to completely avoid, which are very few, but there are a few out there. There are foods you want to modify. So when it comes to foods that you want to avoid, we recommend avoiding foods that have a higher than average risk of carrying foodborne illnesses. And pretty much the only main food of that is honey. Honey has a risk of carrying infant botulism or botulism that in infancy can be extremely devastating for a baby. So we avoid honey and we would avoid things like hard candy and potentially, foods that have very low nutritional value for a baby that also are quite risky, like a hot dog. But most other foods that are nutritionally sound and ideal for a baby, even though they might be a high choking risk food, like for example, we see grapes here and we see an apple here, both of which are high choking risk foods for young babies, can be modified to be made safe for babies. So we are trying to eliminate some of those elements that make it very risky for a baby. So with the grape, that's the fact that it is round and small and slippery and even a little compressible. All of those things will be a little bit more risky for baby. It's not that they're going to immediately choke, it's just that it increases the likelihood of them choking on this. So you would not serve a whole grape to baby, we would modify that. And for a 6-month-old baby, you're going to have to mash it and probably mix it into another food because they're not going to have that pincer grasp to pick up small pieces just yet. When it comes to the apple is hard and it's crunchy. So when you bite off a piece, that piece can be round and hard and slippery. Tapered as well if you're cutting it into a wedge. So we would modify the apple to either cook it until it's soft, or you want to cut it in a thin, sort of wide, flat piece so that you don't end up with round tapered edges. So pretty much any food out there that you can think of that is nutritionally sound can be modified in a way to be made safe for baby. And the Solid Starts app and our food database has examples of how to do that for every food out there for baby at 6 months, 9 months, 12 months, 18 months, in order for you to know how to reduce the risk and make it safe for your baby to explore at any given age. So let's talk a little bit about gagging versus choking and what you're going to be looking for, because as your baby is learning to explore solids, just like Kim said, you're going to experience mistakes. They're learning, they're trying to figure out how to chew this food. They don't have chewing skills just yet. They have chewing reflexes, and those reflexes are helping them learn a new skill of coordinated chewing. So in the meantime, your baby has what we call protective mechanisms, protective reflexes that help make it safe for them to try to chew and to explore that food in their mouth. And one of those big protective reflexes is gagging. So your baby's ability to gag, which most of us are familiar with, but that's opening the mouth, thrusting the tongue forward, making a face like they're going to vomit. It actually is a whole host of things that's happening in the throat. So you have squeezing of the throat to push food back up. You have a closing of the airway to keep anything that might be coming up from entering the airway. And oftentimes you hear coughing, you may hear retching noises or even some crying that goes along with that. So gagging is protective. Like I said, it closes the airway as it's pushing things up and out, trying to move them away from the airway so that nothing ends up in the airway.
I like to think about gagging as the body's way of saying, wait, something's not working here. For those of you that have young babies, you may see your baby gag on a bottle or a pacifier or their own hands. But essentially, until a baby starts solids, the only thing that they've had the need to really manipulate in their mouth is thin, one consistency, one temperature, essentially one flavor, and something, the day they start solids, food goes in their mouth and they're like, wait a minute, what is this? And their brain's like, nope, red alert, this isn't right. I'm going to gag, close off my breathing tube so I can't choke on it. And I'm going to push everything forward out of my food tube so I don't swallow it, because my brain is not so sure that this is what's supposed to be there. It's completely okay and normal for a baby to gag.
And we want parents to know that it's expected. Again, it's part of what helps to keep them safe. Not only do they have what's called a tongue thrust reflex, which is the drive to push their tongue forward to push food out of their mouth. So if they get a piece of food in their mouth, they'll naturally begin to chew. But then if they bite off a piece, the tongue wants to push that back out. They have this gagging reflex that helps to move anything else back out of the mouth so that they have some time to explore it, and then they can get it back out of the mouth. So we expect it. We want babies to do it. It's not a like negative side effect of starting solids. It's part of the process. Choking, on the other hand, is a medical emergency. You need to respond quickly to baby with appropriate choking rescue. So firm back close to baby's back. And we want parents to know that it's quite rare. Your baby is designed with these reflexes in place and with their anatomy in place that helps to reduce the likelihood of choking. And the literature supports this. It's incredibly rare for choking to happen when a baby is showing all the signs of readiness, seated at the table, and they're monitored by an adult being served appropriate foods.
So the media loves to make choking out as one of the leading causes of infant death. And while every single infant death I wish was preventable, I think it's helpful for parents to know that statistically speaking, choking in infancy causes less than 1% of deaths. It also is more likely to occur on non-food items. So when we're thinking about preventable causes of mortality and morbidity, the number one best thing you can do is to get on the floor and pick up non-food items that your baby may pick up and put in their mouth. One other way that we can help babies prevent choking is to let them feed themselves. So I know we've been talking a lot about self-feeding from a infant-driven perspective here, but an important component as well is that the literature is quite clear in not only the adult population, but the kid and infant population. And interestingly enough, kids with developmental disabilities and kids that are typically developing, feeding yourself decreases choking risk. The explanation tends to be that when we are actively engaged in a task, our brain is prepared and can make an educated guess about what's about to happen, what that food feels like, and how it's going to move around in our mouth. As well, when we bring that food to our mouth, our brain says, I'm going to bite into it and I'm supposed to start doing something. So self-feeding, the literature tells us, decreases choking risk.
And I'm just going to add right now, Lucy, we're not monitoring the chat. So I don't know if people are asking questions and you want to pop them in. We are more than happy to answer as we go, or we can loop back around to that at the end.
I think you can go on. There was just one question from Caroline, and we can get that one when you finish. So
Perfect. And we do want to touch a little bit on allergen introduction, because I know this is something that comes up a lot. And we want to talk about what the recommendations are for most babies, and then one specific group or high-risk babies and what we need to work on with allergen introduction. So the American Academy of Allergy, Asthma, and Immunology, did I get all the A's and the I's there? It recommends that babies are offered common allergens when they are showing signs of readiness. And not only are those allergens offered early, they are kept in a baby's diet throughout the first few years of life. So those 9 common allergens, and let's see if I can do this, are peanut, tree nut, milk, soy, sesame, wheat. Did I say dairy?
We've got milk,
Dairy,
dairy,
or sorry, egg,
finned fish,
and shellfish are our 9 common allergens. The literature is the most supportive of introducing egg, peanut, and dairy right off the bat. The recommendation is to introduce 1 allergen at a time. So you don't have to introduce one food and wait 3 days and introduce a new food. But what you do want to do is not pair a common allergenic food with another allergenic food. So for example, baby Charles here in this video is starting to have a very small exposure to peanut butter. After he had this exposure, mom would want to wait 15-20 minutes and look for signs of an allergic reaction. We have some great photos on our website of what allergic reactions look like on a variety of skin tones, because they can look a little bit different. But as he is, he had his peanut butter and now mom's going to sit and watch, he could absolutely have a broccoli floret right now. He could have a piece of mango right now, but we wouldn't want him to have yogurt at this moment, because you want to be able to only offer 1 allergen at a time, so you can identify which or what food it was that caused the reaction if it happened. And if you offer 2 allergens at a time, you would increase the risk that that reaction would be more significant if they happen to be allergic to both foods.
And there's other little things like we recommend going low and slow. So start with a small amount. This baby is getting fed multiple bites of this food. If this was his first introduction to this food, we might just start with that 1 little finger of it. And then you would stop and you would wait until the next introduction, either several hours later or the next day. Again, if you are looking for more on how to introduce common allergens, we have a guided pathway within our app for families that is incredibly helpful, that gives you lots of specific tips on what time of day to introduce them and what amounts to introduce and how to do it to keep them in the baby's diet consistently, to give parents that peace of mind that they are doing what they can to reduce the likelihood of their baby developing an allergy to, or like a life-threatening food allergy to one of these common allergens.
We have been very lucky to work with really incredible pediatric allergists through our work at Solid Starts and through our career. And one of the things that has always hit me very, very deeply is that food allergies in infancy are rare. So anybody who has not introduced allergens because of fear, know that it is very rare for a baby to have a severe allergic reaction. And the literature is very, very strong that when you introduce it early, the likelihood of them developing an allergy is much, much less. Specifically with peanut, your baby is 88% less likely to develop a peanut allergy if they are introduced peanut early and it's kept in the diet. At least once, the literature says 2 to 3 times a week, but our allergist tends to say if you can get it in once, that's great. Now, I do want to mention one group of babies that are a little bit different, and these are babies who are at high risk for allergy development. So in the past, it was believed that if you had a family history of allergy, that your baby was then higher risk for developing an allergy. Well, the newest research tells us that the #1 predictive factor of a baby having a food allergy is moderate to severe eczema. So if you have a baby with moderate to severe eczema or an existing allergy to another food, they would be considered in the high risk category. Now, the literature right now is supportive of starting those babies on allergen exposure, specifically again to egg, peanut, and dairy as early as 4 months old. Now, that's not for every baby, but for that high risk group, the literature supports starting that early and continuing those exposures over time in order to decrease their risk level the most. Our allergist also recommends that if your baby falls into this category, to discuss a plan with your primary healthcare team and potentially even consult with an allergist to come up with a plan, because they may have a very specific schedule that they'd like you to follow.
All right, that was the quick and the dirty version of starting solids in a baby-led way with a focus on independence and engagement and following a baby's lead. If there are specific questions, we are more than happy to answer them now. Sometimes it's helpful to think about this through the lens of whatever you're experiencing in the moment.
Perfect. Let me read a few questions that we had, and in the meantime, you can share more of your questions in the chat. Caroline was asking, what about slippery foods like banana or avocado? How do we help them grab those?
So yeah, the first thing to keep in mind is just that they're very challenging for young babies to grab because they slip through their hands. While it is occasionally frustrating for some babies, and you have temperament differences where certain babies get extremely frustrated and lose interest in the entire meal, most of the time babies are more resilient than we give them credit for, than we expect. So it's actually valuable to let them try to figure it out. And you saw that video of baby Maeve picking up that large piece of pear, which can be quite slippery, and she kind of struggled with it at first, and then she brought in the other hand. It's building problem-solving skills for them to figure out how to do that on their own. That being said, we can do small things to increase the likelihood of them being successful. For example, just cutting little notches into the food adds some texture to that food and gives the fingers a place to rest, which makes it more likely for them to be able to successfully hold on to it and not lose it. It's not just holding it, but it's also knowing how much to squeeze. So a baby that squeezes too hard is going to mash it or lose it because it's going to slide up or down. So baby is problem solving in that. They may squeeze it too hard and lose it a couple times, but we would expect that by the 3rd, 4th, sometimes 8th time, baby's going to figure out, oh, I need to hold it a little bit lighter. And that is building kinesthetic awareness in the hand. It's building proprioceptive awareness in the hand. It's building motor skill and coordination.
You can also, if you have something sticky like banana, you can also finely grind nuts or seeds. If the nut has already been introduced and has been ruled out for an allergen, you can finely grind that and roll that on the outside of the sticky food, which can also make it easier to pick up and hold.
Yeah, and know that those foods are more likely to make your baby gag, because if they get to the mouth, they're also quite slippery and sticky in the mouth. Not unsafe, but you will tend to see big gags with those foods rather than immediately spitting them back out, because they kind of stick in the mouth. So we want baby to have a little bit extra time to get them back out. And if you feel like they're making the baby too frustrated, you can always just wait a couple weeks for baby to try other foods and then go back to those.
Perfect, thank you. From Matilda, what about seasoning and spices? that the rest of the family may be using?
Yeah, we actually were just talking about this on our Instagram page today. Seasoning and spice are excellent to introduce to your baby because the research tells us that the more a baby is exposed to a certain flavor, specifically in this case, a flavor of food in infancy, the more likely it will be that they will be open to exploring that in toddlerhood and beyond. Now, that can be different herbs, that can be different spices that your family enjoys. If you're a family that enjoys really super hot foods, we do recommend you start slowly. So only do little bits at a time and potentially pair it with a cooling food like yogurt. But it's completely okay to expose your baby to these flavors that your family loves. Now, we get a question all the time about salt. Sodium is a hot button topic across the globe in terms of what babies can and cannot have. And our pediatric gastroenterologist and dietitian have actually dug really deeply into the literature and have found that there is no specific reason that is unsafe for a baby to have some salt in their diet. The recommendation is to offer food that tastes good, and we all know that a little bit of salt makes food taste good, but just don't add any additional salt to baby's diet. So if you're cooking a family dish that has some salt in it, it is completely safe to share that to your baby or share that with your baby. But you can just add additional salt in your portion of it after you've given some to baby. But try not to be super afraid of sodium. It is not dangerous for your baby to have salt in their diet. The amount of sodium that your baby would have to consume for it to be dangerous would be, they'd have to like drink out of a soy sauce bottle. This is not the amount that would be in a traditional dish.
And somebody just asked the same thing for sugar. Yes. While we would like to curate baby to have a wide variety of interests and a wide variety of flavors, so we don't want to only serve them super sugary food or super salty foods, because the more we eat those foods, often the more people, babies and adults alike, want those foods. It is perfectly fine to share foods that you enjoy and love that are sugary or that do have sugar in them, knowing that it's not going to harm baby. But if you think long term and we're thinking about getting them exposed to a wide variety of other flavors, we don't want to only serve those flavors, and we want to make sure baby develops an interest in more subtle flavors. So we recommend balancing some meals where of course, it's a special holiday or maybe sister's birthday and there's some cake or ice cream. Of course, share that with baby. There's no safety reason why you can't, but balancing that with other days and other meals where you're serving them, for example, vegetables roasted that are a lot more subtle in their flavor, that don't have a bunch of sauces and sugars and salts added to them.
And while we wish the literature was clear and it directly stated avoiding sugar until this age will create a child that doesn't have a sugar preference, that simply doesn't exist, despite the fact that you typically hear a recommendation of do not offer sugar until age 2. That's kind of the thing that we hear. There is no research. That number's arbitrary, unfortunately. And so we also know that you can avoid sugar and give your child no sugar from the time that they start solids. There will be a time where they are out of your complete control and they will likely get exposed to that food. And the research does show that when sugar is restricted, a child is more likely to eat more of it when they have the opportunity. So our dietitian is very pro small exposures that are meaningful to your family and not just like leaning on those sugary foods, because that does take up space in the belly for them to have the interest and the desire to eat other things.
Perfect. Question from Nabila. Thank you, Kim and Kary. I would like to ask you about the opinions I heard the most from moms around me is giving meat first versus vegetable first. Is that really true that baby should not eat veggies more than meat because vegetables might cause difficulties baby's digestive system to absorb the nutrient more?
Yeah, so it's interesting, like Kim was saying, in terms of sugar and the research behind amounts. There's no research that shows introducing vegetables first or vegetables in any given amount is going to fill the baby's belly and harm them in any way. What we know is that babies around 6 months old tend to be slowly dropping in their iron stores, and they are particularly at a place in their life where they benefit from food-based iron or exposure to iron through food. So we do love prioritizing meats and other vegetables that are high in iron in order to help increase the iron levels in babies' bodies. So that's why you would lean towards meats, but there is no research-driven number of bites or amount. Even the research that says aim for this amount is really scattered and unclear on what that amount is or how our bodies are going to absorb them differently. So we like to just aim for iron-rich foods or prioritize iron-rich foods over other foods, but we also know that veggies are super important. And we know that 6-month-old and 7-month-old babies do not have the motor skills to chew and eat a wide variety of foods. So the likelihood that they're going to eat a whole plate of veggies and fill their belly is extremely unlikely. So prioritize iron-rich foods, but go ahead and serve veggies. And it does not necessarily matter based on the current literature, whether you start with veggies or start with meats and iron-rich foods. You can go either way.
And there is also no data to support the idea that their gut can handle one more than the other. You will see, and it's completely normal, that if your baby is eating something more fibrous, you may see pieces of that food in their stool. Completely normal. This does not mean that they are not absorbing the nutrients. This does not mean their gut is not handling it well. This is just their gut adjusting to having something completely new and different in it. And whether you offer those options at 6 months, 9 months, or 12 months, their gut is still going to react in a way that it needs to figure out how to process that more fibrous option. So I think because sometimes parents will see, the skins of corn or whatnot in their baby's stool, they believe that their gut is not able to handle it, but the research does not support that.
Perfect. Another question was about rice or quinoa, and about the choking hazards of these small piece foods.
Yeah. So the interesting thing about things like rice and quinoa is that the baby's airway is about the size of a drinking straw. So if you're thinking about it's small, but it's much bigger than a grain of rice or something like quinoa. But what we see a lot is that those foods scatter in the mouth and they are hard for a baby to manage. And so we see a lot of gagging and coughing and spitting. It just can be kind of challenging. So for a young baby, especially your 6 to 8 month olds, what we tend to recommend is take the back of a fork and mash it together a little bit and even mix it into a porridge or something so they're able to hold that food together in their mouth a little bit better, and it will cause less of that coughing and discomfort with the food. Even your 9, 10, 11 month old babies are still going to struggle with that texture because of the way that it moves around in the mouth, and smushing it a little bit with a fork can be really helpful.
We recommend using what we call binder foods. So yogurt or any type of sort of soupy puree can help pull those foods together and hold them together better, so they're less likely, again, to scatter and to cause a baby to cough and choke. But you can serve those foods even starting at 6 months old.
And because you asked about choking specifically, those foods that are very small and scatter would not be foods that blocked the airway. So those foods would not stop baby from being able to breathe if an uncoordinated swallow were to occur. In a very rare occurrence, could a small grain of rice or a piece of quinoa be inhaled? Yes, that could absolutely occur, but our bodies have many protective mechanisms to stop that from happening. So even if they do take a deep breath and get some rice towards the back of their throat, they will immediately cough. Their airway will immediately close itself off, so that can't go in. But something that small would not be stopping a baby from breathing. So always try to remind yourself, if your baby's coughing, air is flowing, they're breathing, it's okay. Coughing is good.
There was one more question about gagging. I came across some advice regarding gagging, which was that one should not hit baby's back, which is kind of natural reflex to want to help the baby. Is it safer for baby to sort out themselves?
Yes, exactly. It is so ingrained in us as parents to want to intervene. And I think a lot of us were raised with, when you cough, somebody comes in and pats you. it actually is more disruptive for a baby for you to do that. It disrupts your natural breathing to have somebody pat you on the back. So unless you believe them to be choking, we recommend staying focused and ready to respond, but to do nothing. So you're just sort of, it's like we call active readiness. You're just waiting for baby to get it out. A lot of times babies who are gagging need your reassurance. So you might say something like, I see that's hard for you. You're working on that. You're trying to get that back out. Oh, that doesn't feel good. Things like that, where your voice, your tone of voice is conveying to baby that they're safe and that you trust that they'll be okay, but you're keeping your hands off of them and your fingers out of their mouth until you believe they are at a point where they're actively choking, where you would need to actually intervene with back blows. So
if you feel like you need to do something, kneel down next to them so they look down at you, because then gravity helps that food come out and forward. Remind yourself that choking is extremely rare. Gagging does not lead to choking. Gagging is going to happen. It can be ugly. It can even lead to throwing up. And it is not fun to watch a baby throw up, of course, but know that that is not unsafe, even though it might be really uncomfortable to watch. So again, kneeling down next to them can be really helpful for your own parent heart to at least know that you're doing something, because you're helping gravity at least bring that food forward.
Perfect. Last question from Shelby. Is there anything to look out for, expect in the diaper as their diet is changing?
Everything and anything. You're definitely going to see differences in smell, in color. You might see some, the more fibrous foods you may see coming out in their poop. It's not uncommon for babies to get constipated when they start solids, because their guts figuring out something completely different. Our pediatric GI doctor on our team recommends offering a little bit of water with each meal, so your baby that can help with the constipation. So about an ounce of water can help with some of that digestion. Other babies might have more blowouts, but it's very normal to see changes in baby's poop when you start solids. Things you would be concerned about would be changes, bleeding or blood in the stool, or any white stool. You absolutely want to talk to your doctor about. Anything else?
Perfect. Is there anything else that you want to add?
I mean, I think we could talk about this all day long, but
like
sure.
I said, we have multiple resources out there for families. So we have a book that is coming out in April. You can pre-order it now on any place you find books, Amazon, other places. We have our app, which has a free version as well as a subscription version to do more. It is an incredibly useful tool and parents absolutely love it. We have an Instagram account that has just so much free content, evidence-based information that has been curated by our team of experts. And we have our website that also has so much content on it. A lot of it is free and fully available for families, because it's really important for our team, for families to have access to this information. So there are lots of different places that you can find more information if we didn't answer your question, or if suddenly you think of something later.
Perfect. Thank you. Thank you, Kim. Thank you, Kary, for being here with us. Thank you for your time. Thank you for the wonderful presentation that you have given to us. Thank you so much
thank you
for
so
your time.
much.
Mhm.